All right. Hi, everyone. Nice to see you. I think I know everyone in the room. So what I'm going to be talking about today is some ALICE data. Some of it might be review for you, and I also have some new information from the pandemic and some recently released information that looks at the impact of children in ALICE households. So just for me to confirm, everyone here has heard before about ALICE and heard about the most recent, which is 2018 data on ALICE? Okay, because I have a lot of slides, and if I can move through the early slides faster, that'll be better. And so anybody who wants to interrupt at any time, the best thing to do is just talk, because once I get my slides up, I don't check the chat very well. And we have a small enough group that if you have a question, need clarification about something, to just give a shout out and we'll address it then is fine by me. So if that's okay with everyone, I'm going to start sharing my screen in order to get the slides up. Does everyone see that?
Yes.
Okay, good. All right. So everyone on this call today knows the acronym for ALICE, Asset Limited Income Constrained Employed. Basically, we're talking about people who are working and still struggling to make ends meet. And what we're going to talk about today are a quick overview of the general ALICE numbers and concept, and then hit on some additional findings regarding the impact of the pandemic on ALICE households and children in ALICE households in the state of Wisconsin. So just a quick refresher that this data comes from a United Way initiative that started in New Jersey in 2009 and has now spread to hundreds of counties across the US, but a big portion of them being in the Midwest area. And so that group has really been, their initial initiative was a huge lift, but they continue digging down to give us more information that's helpful, and also put data tools on websites so that you can go and do your own research. And so we'll talk a little bit more about that later, but I just wanted to give props to the people at United for ALICE, which are doing all the hard work here. So what they've done is they put together budgets, two different types of budgets for every county who's involved in the study, which includes Door County as one of the counties that's looked at. And we've got survival budgets, which are just the bare minimum to get by, and stability budgets, which is where we'd like all of our community members to be, is at least at financial stability. And so these are created in comparison to, or as an alternative to, the federal poverty level. And I just put up these numbers to show what they are. They increase a little bit every year. Actually, the difference between 2021 and 2022 is the biggest jump that I've seen in these numbers in a while, which is saying something. So that we went up a whole $700 and so for a single adult, and went up $1,250 for a family of four. That's been the biggest annual increase in a while is interesting. Just also the status of the numbers themselves show that it's not surprising when you look at these income levels to understand that people at these income levels are struggling to get by. And when you're earning more than this money, it doesn't mean that you're not struggling anymore. And that's what United for ALICE did, is that it gathered information on locale specific, so county specific areas, about the actual costs of living, taking into account numerous categories that require finances in today's world, to live and work in today's world, and adding those up to give us the minimum amount of money required to really get by. So the categories that they look at for the survival budget include housing, childcare, food, transportation, healthcare, technology, because that is really a necessity these days. And I think we all understand that. Taxes, because we're talking about people who are employed. So we take into account the amount of taxes that come out of their budget. And then this 10% fluctuating takes into account that not all categories are steady over the course of a year. So for example, utilities, the cost of utilities or the cost of gas might change over the course of a year. So they put in some of that into the budget in order to get as good an estimate as possible. And what they do is they gather the costs of these things for different types of households. So what it costs for a single adult is different than for two adults. It's not just a single adult times two, because the two adults share a household. You might get some economies of scale with food and transportation, that you can share a vehicle, but they've really dug down deep to gather specific information on different types of households in order to identify the amount of money that's needed for each type. So what we do is they gather this information. So we have each one of these categories that I listed above and each one of the types of households across the top. And this is data that comes from a local or state or federal resource like the US Census or the Bureau of Labor Statistics, routinely collected data that is trusted and reliable. If you compared it to, say, the listings in the Door County Pulse for housing or something like that, you wouldn't necessarily get these numbers, but we can trust that they've done as good a job as they can with reliable sources of information to get these numbers for us. And based on all of the presentations that I've given and talking to people, at least when it comes to housing, we think that they've underestimated the cost of housing in Door County. So these truly are the minimum budgets needed to survive. So we add this up in each column and we get these totals at the bottom. So the monthly total required for each of these households multiplied by 12 gets you the annual total. You divide that by 2,080, which is 40 hours a week for a full-time job, and it gets you this hourly wage that's needed. And this is the total hourly wage within the household. So if you've got two adults, that could be by some combination of those two adults, one person working, one person staying home, both people working full-time, one part-time, one full-time, however that's done, that this is the total hourly wage, the aggregate hourly wage in the household needed at full-time in order to come up with these numbers. So when we look at that and we identify those numbers, and then they go to the census and they see how many households, because that's the data for the census, fall beneath those annual totals in each household, we find that in 2018, 9% of the households in Door County were below the federal poverty level, and an additional 22% were under that ALICE survival budget. So that in the past, this group, when we only had the federal poverty level as our index of poverty or struggling to get by, that these people were falling through the cracks and not getting a lot of attention. So this research has really shone a light on the people who are working and still struggling to get by, and due to their jobs may also may become ineligible for those benefits that people under the poverty level can receive.
Christina,
Yep.
I'm sorry.
Yeah.
The slide prior to that last one.
This one?
Yes, didn't there used to be a line for utilities?
I don't believe so. I believe that's
No?
included within housing.
Okay,
Correct.
all right.
So anything you need to run your household is included in that housing line item.
Okay, thank you.
So that may make you appreciate even more that these numbers for Door County seem to be low.
Right. And so that would also include any kind of renters or homeowners insurance.
Correct.
Any other questions?
By the way, I might just throw in as an aside that I heard this morning that propane in this next year is going up more than $1 a gallon.
It's crazy.
So throw that into the mix.
Yeah,
Yes.
that is really going to be hitting a lot of people really hard.
Huge.
So,
Well, I'll just throw into the mix the island because I'm looking at some of these numbers and I mean, I'm like there on some of them with 2 people in a household. So it's a
Yeah.
little scary.
yeah. And these are 2018. So even just through the course of inflation, these numbers would be higher. And there's always a lag in the report. So at this point in time, we're almost at the maximum amount of what I would call lag or disconnect between the numbers that we're sharing and where we are to date. Because a new report will be coming out this summer, which will report data from 2020. So in 2022, we get the data from the 2020 census in the report that's been compiled and analyzed. So that still won't capture all of the pandemic, which is why we have this interim report, this sort of bootstrapping interim update report that's been provided. But these are still on all of the categories, the most recent data that we have. So yeah, they are striking in terms of today's world where we are. So this just shows between 2010 and 2018 that we've been pretty steady in Door County. We've had some bumps in the ALICE numbers and the poverty level, but for the past few years, they haven't changed much. We expect that come that 2020 data, we will start seeing some shifts in this because of the pandemic. But even before the pandemic, we were wanting to make a difference to start turning attention to the ALICE households and helping out, given that they're not moving a lot here. So I just wanted to share this to bring everyone up to speed on those numbers over time. So then the stability budget are those same categories, but now we add money for savings because we know that stability means that you've got some money to tap into for big fluctuations in prices like gas and things like that. But also if you have an emergency and just that long-term stability, having savings and building that over time is helpful. So the categories also make adjustments where, for example, a single adult in the survival budget is based on a studio apartment, and in the stability budget, it's a 1-bedroom apartment. And for childcare, it's higher level childcare at a licensed group center rather than home-based providers. And not that that's higher quality, but just cost-wise. Taking that into account, food, that they use the food pyramid, this thrifty savings plan or food pyramid thing. And for the stability budget, it's 1 level up. So even though it's the same categories, they've made adjustments in each one of these categories so that it's more stable, you might say healthy healthier choices for each one of them. In technology and the survival budget, it is just having a cell phone. And in the stability budget, it's having a cell phone plus internet at your house, which once again, we can talk about Door County and internet access, but they're doing the best they can to cover all the bases across the various households. So just an example to help us refresh our memories about where we stand with survival budgets compared to stability budgets, that remember that slide that I showed on survival said, this is not meant to be long-term. This truly is the bare minimum to truly get by. And these are the numbers that we had for 2 types of households, a single adult, 2 adults, and 2 kids in childcare. Going to put up comparison of the stability budget for these 2 categories, and you see the significant increase in that. So as we move forward and I dig down into looking at specific occupations in Door County and what those wages are, I use $22 an hour because our goal is to really have our households be at financial stability, not just financial survival. So I know a lot of attention with all of the ALICE data. The ALICE threshold is the survival budget. But I think it's important to not lose sight of our ultimate goal is stability. And so to frame the conversation, to include that in the conversation as we look at numbers. So now this doesn't come from United for ALICE. Data that I have on wages in Door County come from Wisconomy, which if anyone has ever visited that site, they pull data from the Bureau of Labor Statistics, but it's Wisconsin and you can get county specific. So I pulled data from there, the most recently available and the closest to our 2018 ALICE data is 2019 wages. So now we're talking individuals, not households, and we've got 14,100 jobs, people working in jobs in Door County in 2019. That's out of a population of about 29,000, just for reference. But within those 14,000 jobs, 39% of them have an hourly wage of $22 an hour. So let's think about, we're going to talk in some more detail about what do those jobs look like. So what we've got is the median hourly wage here. And so I sorted it from lowest to highest. And you see, it's not surprising. We've got food and beverage workers, we've got tourism people, retail sales, but the cooks, health and personal care aides. But these are the people that our economy also relies on, year-round residents as well as the seasonal residents. These people are key to Door County's economy, and this is the median hourly wage. Here we're at $16.37 an hour. We keep going up to reach that $22 an hour. And you see now we're capturing supervisors of personal care and service workers, supervisors of food preparation and retail salespeople. And we've even got construction trades workers. I think it's important to highlight that. A lot of people talk about there really can be some good paying wages in construction, some jobs with good paying wages, but the median wage, this comes from the Bureau of Labor Statistics, shows that in Door County, people in construction, the median wage is $19 an hour. And we capture some more manufacturing jobs here. And we've also got social workers and counselors, and we've got some health people here. So even in sectors which traditionally get a lot of attention, people on the street say those are good paying jobs. And they are good paying jobs. relative to a lot of wages in Door County. But we need to be thinking about where we have to be for stable budgets, and these are still falling short of $22 an hour. Jim, you have your hand raised?
Yes. So a question that I get asked occasionally, and so I just want to clarify it on your statistics. When you go back to the wage for food and bar servers, does that include their tips, or is that just the hourly wage?
For the Bureau, from the data from the Bureau of Labor Statistics, that's a good question. I'm not sure. I would be venturing a guess. I can look that up for you.
I would guess it's what they're reporting on their taxes.
Yeah.
So keep in mind a true server wait staff, their minimum wage is what, $2 or $3 an hour. So that again is my guess, though, that is with what they're reporting on their tax returns for tips.
Any
Which-
other? Oh, sorry, go ahead.
I guess I just wouldn't add an editorial comment, which is that is really at odds with what I think the general public thinks that that waiters and waitresses make, because they make so much money on tips that they're fine. So yeah, that's helpful. Thanks.
Yeah. And this, a lot of people also, it's those stereotypes really kick in. And I just mean stereotypes in terms of the way our brain works and the way that we boil down a lot of information into meaningful nuggets for us. This is also capturing people who work at McDonald's, people who work at Starbucks, and those people aren't getting tips, right? So there's still a lot of food and beverage workers that are not at your restaurants in Door County, which is where I think a lot of people, their minds go when they think about this category. Any other questions about this data? Because this is something new that I've added recently, so people haven't necessarily seen this before. Okay. So now we're going to move on from the basic, the ALICE data into the effect of the pandemic on ALICE households. And I want to take a minute. We're going to have some group participation, thinking about those occupations now that we have a sense of those people who are falling below $22 an hour. So more likely, not for sure, but more likely to be in an ALICE household based on their wages than other occupations. Think about more deeply about what their situation is like. So do you think they are paid by the hour or that their salary? Anyone?
Hourly.
Do they have health insurance benefits or dental or vision benefits?
Some.
Just call out your reactions to, because it's more than just yes, no, just thinking about these various things and what it means for your quality of life and your stability. What are your thoughts on these categories? Thinking about the occupations that we talked about, we just covered.
No, you can't get sick. Your kids can't get sick. You can't go to a funeral if your parent or someone close to you dies. You're not getting paid if you go to take care of whatever those things are. That's a lot. The sick leave, vacation, and sick leave makes me very angry as well, because that's endangering everybody. They don't let people be healthy. How can they do a good job? But I understand a person coming when they're sick.
Mm-hmm.
I just think about the cumulative effects of some of these things that, you know, we can go maybe 6 months or 9 months or a year and not have vacation. But when you start adding those things on year after year after year of no paid sick leave and no paid vacation, no time off, it really starts taking its toll, not only in people's mental health, but eventually their physical health as well. And then to think of the stress of cumulative effect of that, and then not having health insurance benefits, it really becomes an overwhelming burden.
Yeah, I think that's really important. Thank you for pointing that out, Jim. The other thing to think about is, in addition to the long term, is even if it's one-time crisis events, right? So you get a flat tire, or your car breaks down, or you break your arm. What's happening here? Think about your insurance and the type of coverage you have. What do you do on a monthly basis in order to save money with your insurance? You have a cheaper plan with a higher deductible, but when that emergency hits, now you have to tap in, you need to cover that deductible. So what happens? Your household gets by with one car, and as long as that car is running, you can do it. But now when something happens to that car, and you've had 2 working adults, perhaps in some households, relying on that transportation, how that impacts your household. So you don't have that cushion, right? And it takes so much time to build back when you hit that. And wherever you are in the long run, what Jim just pointed out, if you've been living like this for 6 months or a year or 5 years, also just where you stand in that timeline and your ability to handle those things. Any other comments or discussion about these categories or the occupations that we talked about earlier in relation to these categories?
How precarious they all are. I mean, my eye set on childcare options, and that is one that's precarious, but your transportation, reliable transportation, and how just one of those things can have a domino effect and have more significant impact in short run and long run.
Yeah. Anybody else? Thank you for your comments. You don't know how much I appreciate it. I do like when we have discussion, everybody always has a different perspective and experiences to add. So it's really helpful. I take it we can go on without a break unless anybody needs a break for a certain reason. Okay. So now the information from the pandemic comes from different surveys that were launched during the pandemic. And I just list them here so that we understand. So the Census Bureau did start having more routine and regularly timed household pulse surveys. But we also have these other types of surveys because people knew it was important to capture what was going on during this incredibly unusual and stressful time for everyone. And United for Alice also did some of their own surveys. So this data then is at a national level. It's what allows the most timely reporting and what was doable. They weren't going at the county level for this stuff, just so you know. But a lot of these things obviously apply to Door County. So overall, I'm just going to run through some specific results that were at the national level. But the overall finding, the takeaway from all of this stuff is that households below the ALICE threshold, so once again, we're talking about that survival budget, fared worse financially, physically, and emotionally during the pandemic. And there's a whole report on this, which I'm happy to share with people if they're interested. I pulled out some findings to share with this group that seemed particularly relevant to Door County, even though they're at the national level. So also one of the important takeaways is that people say, well, we had things in place, the stimulus programs, there was a lot of food assistance, there was the eviction moratorium, so people wouldn't get kicked out of their rental housing, people had mortgage relief. These surveys take that into account, and those households below the ALICE threshold still did worse, despite those protective measures that were in place. So looking at households above the ALICE threshold and those below the threshold were more likely to have worked in hourly paid jobs. So when there wasn't work and things shut down, they weren't getting paid. To experience a change in employment status, so being temporarily laid off. So 35% had a household member who lost a job and 22% had a household member temporarily laid off, compared to 14 and 12% for those above the threshold. So essentially about 10% higher rates in the ALICE households. Worked reduced hours or quit because of their children's classes and the effect of that during the pandemic. Because their hours were cut or they were laid off, they had to look for alternative sources of income. And they faced barriers because of health issues and lack of a limited or lack of paid 6 days. So this was really an amazing statistic to me, that 45% of the workers in households below the ALICE threshold had no paid sick days, compared to 18% of people above the threshold. They also had concerns about housing expenses. So we see here that they were not caught up on rent payments, fluctuating between 19 to 28% of renters were not caught up, compared to only 7 to 11% of people whose household incomes were above the threshold. They did not spend their stimulus payments in general on toys and flamboyant gifts. They used them to cover basic needs. And they also needed, in addition to looking for alternative sources of income, they were borrowing from friends and family to get by. All of these things combine to also result in elevated symptoms of anxiety and depression. It can be your finances, but also when you hear the stories about the people in the jobs, the retail stores, the people in the grocery stores, on the front lines, those essential workers who got a lot of attention at points during the pandemic, but they didn't have an option. If they weren't working, they weren't going to get paid, but working presented lots of stress also. So lots of various factors coming together to result in elevated symptoms of anxiety and depression. And that's just a snapshot of what happened during the pandemic. But what's important to think about also is where these families stood before the pandemic. So the position they were in to withstand this, this tidal wave of economic and social and family factors that came with the pandemic. And this touches on exactly what Jim was just talking about, that long-term impact on ALICE families. So this is going back to 2008 with the Great Recession, that ALICE households still were recovering from the Great Recession when the pandemic hit. And so they were already still fighting back. They weren't even at even ground and got hit. They also are less likely to have assets to tap into for financial support during hard times. So we talk about this before about individual households facing economic crisis, like you've got a big health bill or your car breaks down. Well, now the pandemic created that intense crisis across all Alice households all at the same time. And they don't have assets to protect themselves. Only 41% of them below the threshold were homeowners compared to 82% above. So you can't tap into that equity or other factors to give you a financial lifeline. You guys may be familiar with some of the data that's been reported recently in the Pulse regarding home prices. This comes from other national sources. So US median home incomes, home prices between 1996 and 2021. Between 2012 and 2021, so a 10-year period, we had a 54% increase in median home prices in the US. I always like to compare that with inflation to help us understand how we're doing in comparison to nationally rising prices. So only a 15% increase in inflation, 54% increase in median home price. But now we get to Door County specifically, and in the past 2 years, our median home price has gone up 43% compared to national numbers of 54% over a 10-year period, which is just pretty amazing, as well as where those numbers are themselves. So people trying to break into home ownership is becoming so challenging in Door County. And that's compared to median household incomes across those same time periods, only increasing 9%. And I don't know, Jim, if you have anything to add on this, given the focus of the housing partnership.
The only thing that I might add is that, you know, I mentioned this at the meeting with some state officials last week, and that is that, you know, wages in Door County are below the state average, and home prices in Door County are significantly above the state average. So, you know, it's sort of a double whammy for our working families here that, you know, it takes more money in Door County to purchase a home, and the take-home pay that our families are making is less than the state average.
Does anybody else have anything to add to that? Because I know a lot of people have followed the housing issues in Door County for quite some time. Okay. We know it's tough to own a home in Door County. Okay. I wanted that to go away. Okay. So also another resource that helps people get by, that people can tap into in times of intense financial struggle, are retirement savings. And the United for Alice folks have pulled together data on retirement savings, which is really interesting. What we've got here are, on the left, households below the Alice threshold, and here on the right, households above the Alice threshold. And we see how they differ in terms of what they have in retirement. So 43% of the people below the Alice threshold have less than $10,000 in retirement savings compared to 10% above. When you get up to the $100,000 to $500,000 range, which is pretty good, but retirement savings, that's still a long ways to go for a lot of people to have a comfortable retirement. We've got only 10% of the people below the Alice threshold and 30% above, and then over $500,000 is extreme difference, 2% compared to 23%. The reason these things don't go to 100, which they don't highlight on this graph, but it's in the footnote, which is something that I think is also interesting, is that the don't knows are not shown. So this total here for below the Alice threshold, all of these numbers are about 82%. So that means 18% of households below the ALIS threshold don't know how much they have in retirement savings, compared to here, we have about 89% above the ALIS threshold. So 11% of them don't know what's in their retirement savings. Just that knowledge is power idea, knowing what you've got is another aspect of this chart. Any comments on this or questions? I don't have much information specific beyond this, but I'm happy to take questions to research information afterwards.
I think this chart demonstrates why what we see in Door County is that many people are working well into their 70s and 80s because that's what they have to do to get by.
Anyone else? Yeah.
Another factor is that our youth don't stay here either. They graduate, they go away, and they don't come back.
I think that's partially true, Jason. One of the things that I see a lot in the work that we do in housing is those who go away for education and want to come back here to raise their kids, come back here and have such a challenge finding housing.
Oh, sure.
They try to make it work for a couple of years. And after a couple of years of just coming up empty in terms of trying to buy a house and become a stable part of the community, they move away again because they can't find anything here. So it isn't that they move away out of a choice of, I don't want to live in Door County. It's, and I don't want to generalize here.
Right.
In the housing work that we do, we certainly hear from a number of families who say, I came back here for a couple of years. I tried to make it work. I can't find a house. I'm tired of renting. So we're moving someplace where we can buy a house.
I think there are also those that go because they realize they can't do it.
I think that's one of the things that the consequences of not having post-secondary education beyond NWTC locally, that it necessitates going outside of the county in order to get a degree. And the offerings at NWTC are somewhat limited. They align with our local economy, but we also know that then those are sort of out of sync with what people see as a lot of the jobs that the young people want to go to are not manufacturing. Healthcare is a strong one in Door County. That's a good paying job. That also, just in terms of sort of occupation reputation data that comes out in terms of being a desirable occupation is good, but otherwise our local feed for jobs and our educational opportunities, that really is a struggle. And I know that the Economic Development Corporation has been looking to strengthen ties with UWGB, which would be nice if we could get some presence of that within the county to help provide some things and have people not go away. But otherwise, it's really hard to tell people, don't have your kids go to college. So it's a big picture for our county. It's something really important to take into consideration, I think.
Yeah, we've experienced that up here because of the trades. A lot of our people are aging out, our plumbers, excuse me, electricians, contractors, and finding somebody to do something is getting a little more challenging when you're trying to keep the business local and support the young families that are here, which is what we try to do. But sometimes you can't get them to come and do the work within a reasonable amount of time, which then unfortunately people bring somebody up from the county and do that. So it's a challenge all the way around in a lot of ways.
Yeah, everywhere. Amy and I have had some conversations about this because it's striking the similar refrains that you hear across the country. So the struggles of manufacturing, the struggles of the construction trades, are not something specific to Door County. And just tossing out, this is truly just Amy and I spouting, but of course, we're really spend a lot of time thinking about these things. We do a lot of armchair analysis, but that as a nation, we have diversified so much in terms of occupations that there's so many choices, so that to get people drawn to these essential things that are really important, we just have so many options. Jobs that did not exist 10, 20 years ago are now in existence, but very few, it seems like very few of those old jobs have really completely gone away. So there's fewer people to hit in each occupation category, and there have to be brighter minds than ours to figure out how we deal with that.
One of the things that exacerbates that picture too is that, you know, and it exacerbates the housing issue as well, is that, you know, we have people whose occupations are actually somewhere very far away from Door County who move here because they want the Door County lifestyle. And yes, they are contributing to the economy in terms of buying things local, but the profits from their work are someplace else, right? And the other piece of that is they also put pressure on, you know, the electricians and the plumbers and the HVAC people. So we've got more people who need those services that are not, whose labor is not necessarily contributing to the profit within the county.
Does anybody want to comment on that or have additional reactions to provide?
Well, and I hadn't thought about that. Thank you for mentioning that. I didn't even think about the number of people who are now working remotely and their job is not here. And but that's similar to the problem of getting a plumber or an electrician with the number of seasonal residents, obviously, and all of the seasonal homes too. Just makes that problem that much more difficult.
Okay. So in looking at some more, we've looked at occupations, information on household budgets. What all of this is currently swimming in is what's going on with inflation and recent inflation. So we have been able to collect this information ourselves, once again, from the Bureau of Labor Statistics, but looking now at the end of 21, after that we're into the thick of the pandemic, and looking at the impact of inflation on what's going on in household budgets. That we've got the consumer price index, which is inflation, and then we've got Alice households that can only afford essentials. And when you look at essentials, those prices, the trends of those prices over time have historically differed from the overall consumer price index. And that's shown in this chart. So this blue line is a subset of the consumer price index, looking at categories of things that Alice households buy. And those are things that they need to buy in order to run their households and make do. And when you look over this 12 year time period, from 2007 to 2018, the difference was that the annual increase in inflation, so that, remember, we're ending at 2018, was 1.8%. And in comparison, those essentials rose an annual rate of 3.4%. One of the things that I've always taken away from this chart is that you can be a server in a restaurant or somebody in those construction trades or those manufacturing jobs that we looked at, those occupations earlier, retail sales. you can be getting a raise based on the consumer price index and still be losing ground because what you have to spend your money on, those prices are going up at a faster, at a steeper rate. And that's just really eye-opening when you think about that. And then this chart shows that, and I just found this recently, which they looked at the retail sales wage over that time period. And sometimes it wasn't even keeping pace with inflation, but over that time period, it matches it, but you still fall short of the essentials increase. So we looked recently at the price changes. These are inflation over yearly time periods. So September 2020 to September 2021, December 2020 to December 2021. This is the recent inflation is just crazy. It's where it hasn't been as this high in 40 years. But looking at these specific categories is really telling, and thinking about where Alice households spend their money. So this is not exhaustive. The list of categories on which the Bureau of Labor Statistics collects information is multiple pages. Once again, I pulled out some things thinking about Alice households to help us understand how much recent inflation has impacted their monthly budgets. So you see food at home, the increases, disposable diapers. It is surprisingly difficult to find information on the cost of diapers. So we don't have anything for December. It's not tracked as a separate category in the Bureau of Labor Statistics, but through other sources, we have that.
I can tell
Energy
you,
prices.
Christina,
Oh, sorry, go ahead.
just managing the diapers wipes formula fund for the partnership. I will tell you that it's probably increased by close to 30%, just on how quickly, and not the number of clients Rebecca's seeing, but what a monthly purchase used to cost her now is costing about a third more.
Thank you. Yeah, so Jason earlier talked about the cost of propane and fuel oil, and we see that's just not going away. We have multiple factors, supply chain issues. People can debate whether the war in Ukraine is impacting this or how it's impacting this. But regardless, the individual households are really feeling a pinch, and I bet you everyone can't wait for the temperatures to get into the 40s and 50s to at least try and get some more relief there. Another interesting thing is that if you're an Alice household, you're more likely to have a used car or truck than a new vehicle. And the increase in that, if yours broke down during the pandemic, what you faced, the prices that you faced to replace that, you got hit harder than people shopping for new cars. So not to say that the prices were comparable, but the amount of increase, what you could have expected to pay a year ago compared to now, quite a bit of sticker shock. So health insurance went down during the pandemic because everybody was staying home and nobody was doing anything. So people were wearing masks, but I believe these numbers are starting to turn around and increase again. So just some insight into some specific categories and how they play into the Alice households. And I haven't updated this now for the first quarter of 2022. But by all the national statistics, the general talk, it's still rough for people with inflation. Now, to compare that to these non-essential items, I told you there's multiple pages of data. Here are some of the things where the prices aren't as high as the overall inflation rate. So if you can afford to go on air travel, you can still afford to do that. It's not hitting your budget much worse than it was a year ago. If you need appliances, if you are taking advantage of some recreation, going to the theater, these are what we're talking about. People who have the money don't always appreciate how those budget changes are impacting Alice households, because some of the things that they're tracking in their daily spending aren't hit as hard as the essential categories. So then just to take a look at some more specific categories about how things have changed over time and how it's impacting Alice households, we looked at student debt, which is really interesting because student debt is not one of those categories that is included in the Alice survival or stability budget, but a lot of people have student debt. And when you take a closer look, you see the impact here. So this is national information, not Door County specific, and you've got actual debt in black and then corrected for inflation in red. So you see, even when you account for inflation between 2007 and 2020, the increase is significant. It's gone up about $14,000 or $15,000. And just this number alone, these numbers of student loan debt, when you think that you're going to tack this on top of rent or home mortgage in Door County, it just shows what a tough hill it is that specifically young families have to address. Any questions or comments about the student loan and how it impacts Door County specific families? Yeah. So a 61% increase in student loan debt compared to 27% increase in inflation. So once again, just a useful comparison. Healthcare, everyone knows healthcare spending is going up, but this helps you see how much. And when we did a survey recently in conjunction, mainly with we got put together a 2-page front and back survey that was disseminated by mostly Neighbor to Neighbor and the ADRC, but it's also, it was at the food pantry at Lakeshore Food Pantry. One of the biggest categories that people have concerns about is the cost of healthcare and how it's going to impact their ability to get by on a month-to-month basis. Emphasized here in Door County with our aging population, I was amazed by the number of people who were in their 70s, 80s, even 90s here in Door County that reported that they live alone. So their ability, their household budgets on a fixed income to afford these things. Really significant impacts. But just as a reminder, one of the things that we have spread the word about here is Single Care, which is the free prescription discount card that is available. And if you don't know about that, getting the word out to anyone that you know, no charge. You can get information here at United Way, but also you can go to the website and people can download a card immediately, right, Amy, and have access to that.
Yep, and if you're a smartphone user, you can just download the app for Single Care. So this used to be FamilyWise. They've now merged with Single Care. So it is the company you see on TV with Martin Short screaming about
Martin
cutting his line. So it is a reputable company. The one thing we always want to caution people with is if you're using the Single Care card and you pay, say, $40 for that prescription that day, that $40 does not count towards your insurance deductible. So if you're chasing a deductible or you've already met a deductible, sometimes paying that higher cost might be the better choice for you, because using Single Care means that $40 does not count towards whatever your deductible is.
Does the FamilyWise card still work if you have it, or do you need to get?
No, it still works.
That'll
We
still
don't
work.
have single care cards yet, and it's been a year, so we're still
Okay.
handing out
So the
family.
family wise one that I carry in my wallet still works. Okay.
Any other questions or comments about that? Also, the other thing that we all use every day, and some of us wish that we could use less, we have our cell phones and our technology. I found some information which was really interesting on this, looking at the increased cost over time. Now, the data that I found only went up through 2013. But if I took that, I also found another source. So although the average annual household spending on cell phone in 2013 was $913. In 2020, that was $1,500 a year, $127 a month. Now that the Alice household budgets, like I told you, are just looking at cell phones, not internet access. But we know that with a cell phone, you have to think about what package you're going to purchase to rely on with your cell phone. And we find, not surprisingly, that the most popular one is this unlimited data volume. And that's probably a sign of the times that people then don't have to worry about whether they're hitting limits. But also as kids are using it for school, people, things for work, this is the way that you have to communicate. It's what people assume that people have access to in order to get by. But that unlimited data service is going to cost more than these services down here that are limited on data. So now we also got some information. This has just been out in the past week. They've been working on the United for Alice people are digging deeper into particular categories. So children in Alice households, also individuals with disabilities. That information is not out yet, but what was just released is the information on children. This is not county level, but at least it's state level, which is helpful. So I pulled out some information here to share with you today, which I thought you might find interesting and might get us to some interesting discussion also. So things that stand out of Alice households with children that make it different, where they look different than households above the Alice threshold, are the work status of the household, the living arrangements, and whether a child has a disability. So we'll first of all look at household work status. And we see here that when you've got two adults in a household both working, out of all of those households in the state of Wisconsin, 80% of them are above the Alice threshold, but still 20% of them are below. So the takeaway here is that even with two working adults, you can have those incomes that don't get you to that level that you need to be. You're working really low wage jobs, or you can only get part-time work, still falling below the Alice threshold. Those numbers, you can have two adults, one of them working, and 54% of those households are below the Alice threshold. And when you've got a single adult working, that's your household across the state of Wisconsin. 67% of those are falling below the Alice threshold. So it's really difficult to get by with just a single income, and surprisingly, even more difficult when it's just you rather than two people in your household. When it comes to living arrangements, we've looked at this data before with Door County, but when we are looking at children, so now these households that we're talking about, all of them have children in them. So married couples in the state of Wisconsin, 27% of those households, married couples with children, fall below the Alice threshold. if you only have one adult, and it's male, single male-headed household, 41% of those falling below the threshold. Unmarried couples, 44%. And single female-headed households, that 66% of those falling below the ALIS threshold. And that does hold, not the specific numbers. I don't have the slide in here that we've looked at before for Door County, but this is the category of households that struggles the most for all sorts of reasons. Childcare, wage issues, single female-headed households struggle a lot. I'm looking at disabilities. So households with one or more children with a disability, 59% of those households fall below the ALIS threshold, whereas without a disability, 36%. They did comment that across the state of Wisconsin, there's about 4% of the households that have a child with a disability. But when you drill down within that 4%, this difference is really striking. So I still wanted to highlight that for everyone. Any questions or comments about those three things? Living arrangements, work status, disability?
You know, one of the things that strikes me is that these categories that you've identified here are, according to federal housing law, protected categories. And yet the fact that they are protected in terms of discrimination does not provide them necessarily with access to the kind of, you know, dignified, clean, affordable, whatever living arrangements that they might need. That just because federal law protects them from discrimination does not mean that they necessarily have access to those living arrangements on the ground where it really matters. So, you know, there is that disconnect, which, you know, at least in my economy, we as a community are responsible for.
Do you think, Jim, that that's a supply issue? Like when it comes to affordable housing, it's just not there. So there is none to be set aside or given to those.
I think in Door County, it is particularly a supply issue. But supply is while supply is probably a big part of the challenge, it's not the entire challenge.
Does anybody else have any comments, reactions to this information?
I really appreciate this slide, and I will be contacting you to see if I can have some of the other data that you have. I know all of you on this Zoom right now can kind of read between the lines of what's happening, particularly that single female-headed household, how they're meeting the housing situations or the childcare situations, you know, how domestic violence might be ongoing. A person might not be able to leave a dangerous situation because who's going to watch my kids? How am I going to find housing? I can't find it, period. Can I afford it, period? So it's putting adults and children in danger. Like that's one that comes to mind here, but it's more striking than I was aware.
Yeah, I think these things, that these categories, the work status, the living arrangements, and the disability, when you keep in mind that these are all households with children, you have to take into account that generational aspect of the struggle and the health of the financial, the physical, the social health of all the individuals in the household, which is an important takeaway and something that needs more attention. I think I just have one, yes. So when we look at in more detail, what resources do the children in Alice households lack? This once again comes from the United for Alice folks and the data they've collected for the state of Wisconsin. This was a bunch of text, but I didn't know how else to summarize it because it was so important. So children in Alice households are more likely to live in rented housing or cost burdened households. So number one, that's just the financial stress of that, but also there can be the stress of moving because it's unstable. 56% of the families in Alice households rented, 44% owned their house compared to 17 and 83% above the threshold. And that 24% of them, now this is what an important takeaway, it's understanding the impact of living in a rented household. So for houses above and below the Alice threshold, children in renter households 3 times more likely to have moved in the past year compared to those in owner households. So you have to sort of read between the lines, but the fact that there's this higher number of Alice families who do live in rented households, and that the fact of living in a renter household means that you're more likely to move, sort of that cascading effect within the Alice households. We are all aware of internet struggles in Door County and across the state of Wisconsin. Then state level data is really interesting. I don't know where we fall compare. I should have looked at the broadband report. I didn't dig down far enough to see if I can get comparable numbers across the state. Relatively high levels of access to home internet, but when it comes to high-speed internet, which is what you need to do your job from home or what you need to do your work from home, you see these numbers starting to drop and bigger differences between Alice households and non-Alice households being revealed. But I'll have to make a mental note to also compare this to the Door County specific information we have from the recent study.
So I'm just going to say this anecdotally, and it's not research or data driven, but we have, for those of you who don't know who I'm the pastor shepherd of the Bay Lutheran Church up in Ellison Bay. And just prior to the pandemic, we opened a food pantry, and we noticed that during the pandemic, the traffic in using our food pantry increased dramatically. It was about the same time that we added high-speed internet to our facility. And we have also noticed our building is open all the time, an increase in the number of folks who just drop by because they need a place to access the internet. So, those kind of, it's an odd pairing, isn't it, of a food pantry and internet access.
No, I love that you did that. I didn't know that that was part of what was going on with the food pantry there. That's great.
And Jason, I think you can personally attest, even though you have high-speed internet just outside of Sturgeon Bay, it is not always reliable or consistent. Is that a fair assumption?
That hits it right on the head.
Yeah.
But it's not as bad as Grace's.
No. So Grace has been one to go to Shepherd of the Bay Church and do her meetings from the hall at the church. So thank you, Jim, for that.
And when you think about that, it's nice to have that access, but one of the things that people are using high-speed internet for also are healthcare visits. And so your ability to do that effectively in a public space, I don't know what all of the access is like, but it's just number one, you've got the school age kids, but you've also got that older population that are using telehealth. Also within our schools, because we struggle with access to mental health providers. The mental health services are also being delivered via telehealth. So it's really an important lifeline. So just the infrastructure within our county is one thing, and then people being able to afford it and have access to it, another level of that. And then healthcare during the pandemic. And so I don't know what counted for the capture of this percentage, and I want to get at it in more detail because I don't know it. This, they says 43% of Wisconsin households below the threshold with children had to miss, delay, or skip their child's preventive checkup in the last 12 months. I think some people would ask me whether that was voluntary opting out of healthcare, or whether really there were other conditions that prevented them from getting there. And I don't know the answers to that question. But we know that getting your healthcare is important, and the difference between the households is one of the things that we also want to highlight.
Christina, this is just my speculation,
Mhm.
but a household that's above the threshold is very used to knowing we have our quarterly 6-month, 12-month checkups. So maybe when the medical facilities reopened for those appointments, they made it a priority to schedule those
Mhm.
appointments sooner. Whereas somebody who's Alice or poverty and it's not always on their radar, but 2, we know they're living more moment to moment. So maybe didn't make that a priority for them to reschedule and get back on that annual physical or 6-month checkup routine.
Yeah. But this then also circling back around again to a comment that Jim made earlier about how these things, the impacts of living below the threshold over the long term. This is one of those things that chronic health conditions, vaccinations, the implications of not receiving this care out into the future is something to pay attention to and to be noted. So that is all that I had for the data that we were going to talk about. I'm glad that we had conversation throughout. That's the way I like to have it, rather than leaving everything to the end. But any final questions or comments that people would like to make?
I think, Christina, I just really want to thank you for this presentation, for the hard data that you've provided. And I think one of the wonderful characteristics of Door County is the way that we sort of rise to take care of folks. Food pantries, all the work that United Way has done for kids' mental health, and yet, I think about some of the clergy gatherings that I've been a part of, where we applaud the fact that there's a program at the hospital that provides dental care for kids who can't afford to go to the dentist, which is wonderful. And all the food pantry opportunities are wonderful, and yet there's a prior question that I have to ask is, are we okay with a community where families have to rely on charity care to meet their basic needs? And so, it's part of my commitment to make sure that we are building a community where these things that you have, so aptly targeted and open for us, that these things are not necessities that folks have to rely on through charity care, but these are just givens that we as a community are going to make sure that they have. So I appreciate that. Thank you.
There was a slide in the very first Alice report. So let's see, 2010. So we would have got it in 2012. And it had the pie chart showing where our Alice families, kind of how they get their support. And about a third of that support was coming from, Jim, what you just referenced as that charity care. And so whether that's a childcare scholarship, was a once a month stop at a food pantry, using the dental clinic through Door County Medical Center. Yeah, all of those things are what make it possible for them to bring some sense of stability to their families.
And I think that's really interesting when you remind people, so we're not talking about people below the federal poverty level. We're talking about people who are above that. Those Alice households are still having to rely on charity care, because people will automatically, I think, slip back into thinking, oh, it's the most extreme struggling households. No, there's lots of people working or in 2-income households that still have to rely on charity to get by.
Right. You know, I was talking with an individual who has been very generous in terms of supporting food pantries, not only in our congregation, but around the county. And, you know, she made the comment that, yeah, you know, we're really happy to provide this support for our families. And then I mentioned to her that I think a majority of the folks who, and this is again anecdotal, not data driven, because we don't keep data on who uses the food pantry. But I would suggest, based on my observation, that most of the folks that are using our pantry are seniors. And when I mentioned that it was seniors that were having to get by stopping by the food pantry, she was just flabbergasted that, you know, that there would be seniors in our community that were living, you know, week to week.
Yeah, one of the slides that we have from earlier presentations where we look at the different types of households, so single individuals, families with 2 kids, and looking at seniors. And within Door County, I believe it was something in 2018, it's like 42% of the senior households are either below the federal poverty level or within the Alice group within Door County. It's really striking. Oh,
And all of us who pay attention to this, I mean, we know people in our circle of acquaintances, you know, as I said, of people well into their 70s and 80s who are continuing to work, you know, and sit down and talk to them and ask them why we're working. It's not because they love their jobs, right? It's because this is how this is what they have to do to get by.
any other comments?
Thank you so much. This was really great. I
Thank you.
feel like I know a lot about Alice, but yeah, having these updated, the different ways that you present it drives home a lot of other great points that I need to keep in mind. Thank you.
You're welcome. Like I said, the people up there in New Jersey who keep doing the work, like they just must go to bed at night with numbers and pie charts and graphs in their heads because they just keep digging into the data, which is so helpful.
So folks, I'm going to go ahead and hit stop record. But I want to thank everyone and especially thank Christina for sharing this with us today.
Thank you. So happy to